So we'll be talking on the principles of treatment, especially among sickle cell patients. What are those principles of treating sickle cell patients? Number one is reporting the case early enough to the nearest medical facility or somebody that has medical know-how. When such cases are reported, the patient should be rushed to such facility. And also, if the patient has infection such as malaria infections, the patient should be placed on anti-malaria drugs. And also, if it is infections that is related to the bone or other like meningitis, the patient should be placed on streptomycin, erythromycin, zithromycin, and these are some of the injections that should be recommended for depending on the allergic or depending on the one that the patient is not allergic to. Also, if it is within children like childbirth, they should always be vaccinated to avoid infections. What are those things that you are vaccinating from? You are vaccinating from meningitis, you are vaccinating from hepatitis. So treatment in the nearest primary health care should always be given to such children. Furthermore, one of other symptoms of sickle cell disease is anemia. And what do you understand by anemia? Anemia is simply when the blood, the PCV of the general body is reduced below 25%. So anemia also arises, and also when anemia occurs, the protein that is found within the red blood cell reduces. And what are those proteins? These are hemoglobin, and hemoglobin carries oxygen, and once it's reduced, definitely the oxygen rate of the body will definitely reduce, and this will now result to the person being transfused. They will transfuse with blood, and also it can lead to paleness. You will see the patient's body will become pale. You see, if you look at the eye region, you see that it become pale. If you look at the palms, become whitish. This is a sign that there is anemia. And also, the patients should be always placed on painkillers. Some of these infections can create a lot of pains, and so painkillers such as paracetamol, diclofenac, ketorol, and other pain relieving drugs. And also, we'll be talking on what are those things that the patient should avoid so that the patient will not break down. One thing about these sickle cell disease patients, there are a lot of things that they need to avoid, and one of those things is stress. They should not be put on stress. They should not be stressed. They should not involve themselves in a lot of activity or some of the activities such as we have excessive exercise. They should not over exercise, and also they should always monitor their temperature. Avoid cold areas and areas that mosquito will give them infection. So these are the lessons that I am presenting today. I remain my humble self, Nurse Ekezi Raymond. Thank you.